The haze does have an impact on the skin. In essence, the haze can increase the ambient ultraviolet radiation in our environment. And ultraviolet radiation does cause skin-related problems, especially in those who are more sensitive to the ultraviolet. You may increase the risk of sunburns as well as the risk of developing cumulative skin damage and eventually skin cancer formation. The haze also contains a lot of particulate matters as well as noxious gas that by itself can also harbor a lot of free radicals, and these free radicals by itself can also cause photoaging. The haze particulate matters as well as the noxious gases also can cause dryness of the skin, and for individuals with even with normal skin barrier function may find that as time goes on, due to the chronicity of the exposure, may develop some irritation to the skin. The particle matters in the air by themselves are also irritative, and they can also cause irritation of the skin. The increase in all these particle matters, noxious gases, can also cause clogging of the pores, and some individuals who are more acne prone may find themselves developing an acne flare. In cases like that, you may have to sometimes take medication, oral medication, to help to suppress the acne condition to minimize the scarring effects. But in essence, I think what's important for individuals with already a background underlying skin condition like eczema problem, you may get an aggravation of your eczema rash, and it can be quite severe for some individuals. It may be a point whereby it becomes very oozy, it may become crusted, it may become infected, and you may need to be seen by a dermatologist or your general practitioner to see whether there's a need to intervene more aggressively to bring about a better outcome. It's important to treat early for an eczema flare so that you can minimize the scarring and give you a better quality of life. So what's important is that for individuals and exposed to the hazy environment, try to have the use of sunscreen, use moisturizers with antioxidants. They're very important because they help to reduce and remove the free radicals from causing damage to the skin. If you do develop any rashes, do see your family doctor or dermatologist to see whether there's a need for escalation of the treatment to improve the situation. Otherwise, try to improve the skin barrier with the use of moisturizers to improve the makeup of the skin, to nourish the skin, to minimize the damage from the environmental agents. For individuals who have background eczema problems, what you can do to try to minimize the flare-up is to use gentle cleansers as well as moisturize more frequently. This helps to at least have like a barrier to minimize the damage or irritation from the fine particles or noxious gas that's in the environment. Also very important is try to minimize outdoor activities, try to stay more within aircon environment or within an insulated environment so as to minimize exposure risk to the skin. Drink lots of water, maintain a good hydration, and in all intent and purpose, do be cognizant of the environmental conditions when you plan your activities.